Our clients are looking for alternative therapies that they can offer or use on their particular pets when they have anxiety disorders. And one great alternative therapy that has been out a short time is Angstitane. Angstitane is L-theanine. It's an amino acid that acts to block the glutamate receptor and facilitate the binding of a neurotransmitter called GABA. So think of it as taking the patient's foot off of the gas and putting their foot on the brake. This product is versatile and can be used in cats and dogs, and it's very well tolerated. What is also really neat about Angstitane is that in one study there was a 93% palatability with cats, and this is pretty amazing because, as we all know as veterinarians, cats don't like to take pills. Many of my patients will eat it right up off the floor. So while it's not a miracle product, it is definitely a product that should be in our arsenal of supplements and alternative therapies that can help improve the welfare and the well-being of animals that have anxiety or fear-related disorders. The next thing that I want to talk to you about is litter boxes. And you would think we'd be done talking about this by now, but we're not done because I'm still meeting veterinarians who don't know the proper size of a litter box. And this is important because remember that inappropriate elimination is the #1 cat behavior problem. And this is still unbelievably so, causing cats to be relinquished to shelters, and we don't want that to happen anymore. One of the primary causes is going to be that that litter box isn't right. What's not right about it? I don't know. It might not be big enough. It might not be in the right place. It might not be clean enough. But if you change the size of a litter box and get the proper number of litter boxes, you can positively affect almost any elimination problem, regardless of diagnosis. So, proper size is the length of the cat from the tip of his nose to the very end of his tail. If it's a Manx cat, go ahead and add 12 inches. So we're talking 24 by 36. These are big boxes. These are under the bed storage boxes like you would get from any big store like Walmart or Target, okay? We want to have, remember, one more box than the number of cats in the household. If you make that recommendation, you will help a significant number of your cat inappropriate elimination cases. And finally, I want to talk to you about trazodone. Trazodone is a medication that we have been using, veterinary behaviorists have been using now for a couple of years. It is a serotonin reuptake inhibitor, but it's a little different than the selective serotonin reuptake inhibitors that you're probably used to working with. It works within about an hour, and it causes slight sedation with some anxiety relief. So it gives us another choice for an as-needed medication for diagnoses such as storm phobia or separation anxiety or fear of coming to see you, the veterinarian. It has a low incidence of side effects, and it is not very expensive for clients. So it's a good option to try out for those specific anxiety patients.